So you have obstructive sleep apnea or sleep disordered breathing. You've decided that you'll be going forward with double jaw surgery. You've done all the research in step one, and you've narrowed down all your options to 3 to 5 top surgeons that you'd consider working with. Now, your next step is setting up in-person consultations, with occasional exceptions, maybe seeing a couple through Zoom, depending on what country they're in. But consultation is your next step. But before I go into consultation, I want to pause and give you a lay of the land in regards to your timeline and how this whole process works. I feel that this portion of the process is not explained to patients very well, and a lot of tension points and stress points for both the patient and the surgeon could be avoided if the patient better understood this process. So we'll talk about that first, and then we'll kind of go into order of how you should schedule your consultations. So consultation, the purpose of a consultation is you meet with a surgeon, you see if you're a good fit, you kind of ask them more in-depth questions about, okay, how far, for example, would you move my upper jaw forward if you were to operate on me in my case? And the surgeon, let's say they give you, 4 millimeters. Well, here's the thing. In your consultation, you're coming up with kind of a rough draft plan. It is not the final plan. And knowing that is important because you're going to have these numbers in your head, and then you're going to get to a pre-op appointment, and those numbers are likely going to change. Between your consultation and your pre-op appointment, several things could change. Your bite and potentially even your face. Orthodontics, skeletal expansion, physical therapy, all of those things can alter your face and your bite. So don't take your plan in your consultation and think that that is for sure your final plan. And then once you have that, the consultation, and you narrow down your options to your favorite surgeon, you choose a surgeon at that point. You then are going to choose an orthodontist who will work with your surgeon in your case. And there are cases where you don't have orthodontics before jaw surgery, but it's rare at this point. In most cases, your surgeon's going to want to work with an orthodontist to prepare you for surgery. You may be the one to find the orthodontist, or maybe the surgeon has an orthodontist or several orthodontists that they work with regularly. So that might be a conversation for the surgeon if you don't already have your own orthodontist that you've chosen. When considering an orthodontist, you want to make sure it's not required, but I would recommend choosing a pair of orthodontist and surgeon that they've worked together before. Like, you're not the first person that they're collaborating with, and you want to make sure that they do a good job communicating with you and each other. I'll be completely honest, I don't see great orthodontist surgical communication throughout the process. I think it's just not built into their practice. They don't have time for it. So sometimes you need to be the lead in terms of questions you have in your case, kind of in the middle part of the timeline between consultation and pre-op appointment. But anyway, so choose orthodontist and surgeon who have worked together before and are open to communicating with you and each other. Now, the next step would be your pre-op appointment. So your pre-op, depending on the surgeon, some surgeons do their pre-ops 4 weeks before surgery. Others do them a day before surgery. And I mean, that, as from a patient standpoint, that sounds very stressful to me, but there are very good surgeons who do their pre-op appointments right before the surgery. But know that the pre-op appointment it's the final plan for the most part. There's some times where surgeons will meet with engineers and they'll modify the plan just a little bit. But overall, whatever plan you and your surgeon come up with during the pre-op appointment, like, that's what they're moving forward with in your actual surgery. Now that you kind of understand the timeline, I'm going to circle back to consultations. So you have your 3 to 5 surgeons that you narrowed your list down to. From there, what I recommend doing is ranking those surgeons. Let's say you have 3 that you have narrowed down. Rank them from most likely to choose as your final surgeon to least likely. and then schedule them in the opposite order. So you want to schedule with the surgeon who you're least likely to choose first, and then the most likely to choose as last. And the reason being, you're going to get a lot better at consultations as you do this. So you're going to get better at asking questions, you're going to be better at the terminology, you'll just be a lot more familiar with the process. And I don't know if you're someone who gets nervous. This is your own body and you're talking about surgery, so stakes are high, and some of us it's hard to think in the moment when it's your health and your body, and you have to kind of come up with questions in the moment. So you want to choose a surgeon who you're likely gonna choose as your final. You want to talk to them last, so you're really good at this process at that point in time. I hope this gives you a better idea of kind of where you're at in this process. And then the next video I'll post will be specific questions of what to ask in the actual in-person or virtual consultation. If you have any questions, please find me at summerspt.com, or go ahead and write a comment or question in the comment section below.